Hi, my name is Bruce Bassi. I'm a psychiatrist with Telepsych Health. One version of treatment for binge eating disorder, one type of psychotherapy that is for binge eating disorder is called cognitive behavioral therapy. There are many different types of therapy, but this is one option. It's also known as CBT for short. So CBT is usually administered by a therapist to either an individual or a group. Typical course of treatment would be 15 to 20 sessions, each about 50 minutes in length, and that would be over a course of 4 months. There are about 6 different components to CBT for binge eating. The first component is breaking misperceptions that people have about triggers to binge eating. The second component is monitoring eating behavior with a diary of some sort in real time. The third component is developing more regular eating pattern. The fourth component is recognizing high risk binge eating situations and developing coping strategies in response to that. Fifth is to uncover, recognize, and address any sort of unusual weighing practices. And finally, the last part of CBT for binge eating is to prevent relapse after treatment is over. So let's dive into the first component, which is breaking misperceptions about weight and body shape. The therapist will talk about over-evaluation of body image, encourage engagement in other interests in life. Also, the therapist will point out that binge eating does not occur spontaneously. It's usually triggered by undereating, which creates a psychologic and physiologic pressure to eat. It could also be triggered by a stressful event, which caused the patient to stress eat. And sometimes when patients ingest a disinhibiting substance, such as alcohol or marijuana, that could also trigger binge eating behavior. The patient might have a complex cognitive rule system regarding their diet that should also be addressed. Now, the second piece is monitoring eating behavior with a diary. So the patient should record in real time each meal, snack, and binge episode in the context for that situation, so that when you look back on that time period, you can recognize what sort of triggers there were for that binge eating episode. The therapist will want to review that diary with the patient at the next session and uncover some patterns, such as binge eating that occurs after work or watching TV or arguing with a significant other. The third piece of CBT for binge eating is that the therapist is going to want to outline with the patient a more regular eating pattern. So we want to avoid these periods of undereating that trigger that physiologic and psychologic urge to overeat. So ideally, the patient will have 3 planned scheduled meals and 2 to 3 planned snacks per day with no more than 4 hours going without eating. The fourth piece is recognizing and responding to those high-risk binge eating situations. In conjunction with the diary that the patient and the therapist have already reviewed, when encountering one of those high-risk situations, the patient's going to want to review their coping strategies to respond to that. So one being surfing that urge to eat and learning to recognize that the impulsive feeling is just temporary and will go away. The process of working through the diary and also talking to the therapist about these stimuli, is it helps bring to the forefront of the patient's mind what these stimuli are in terms of people, places, and activities that trigger that urge. Fifth, in terms of addressing unusual weighing patterns, the therapist is going to want to educate the patient to only try to weigh themselves about once a week to address any sort of misperceptions that they might have in terms of weight control and how quickly that might change over time. The therapist is also going to want to educate the patient on normal weight and BMI. And finally, the therapist is going to want to review relapse prevention with the patient. So they'll review all the progress that they've made over time and also talk about what sort of relapse triggers that the patient might have, such as recognizing a single event that could potentially escalate, such as responding to criticism or adversity, and then developing a plan should that occur of getting back into treatment. So this is just one treatment option for binge eating disorder. There are also self-help versions of CBT consisting of internet-based sessions, but there was one study that compared the two and over 6 months found that in-person CBT with a therapist was superior at reducing those binge eating days.